Alabama is trying to get part of a $50 billion rural health fund, and the application to the federal government is due soon.
Some have hoped that money will help save rural hospitals, which have been closing in Alabama and elsewhere. Our investigative reporter Brendan Kirby has been looking into this.
And Brendan, from what you found out, it probably won't stop hospitals from closing.
Yeah, that's right, Lenise and Cameron. That money has strings attached and it won't last forever. So while it has the potential to improve healthcare in rural areas, it probably won't save hospitals. The One Big Beautiful Bill Act includes $50 billion for rural healthcare. When it passed over the summer, Alabama U.S. Senator Katie Britt noted the problems facing rural hospitals and called it a huge victory for the state. But as Alabama prepares to apply for a share of the money, experts and policymakers say hospitals that are struggling to stay in business shouldn't count on the federal fund to save them. State Senator Greg Albritton, who represents parts of Mobile and Baldwin along with several other neighboring rural counties, says there are restrictions on how the money can be spent.
I don't think this is going to be a means whereby we can just put different monies out so they can make payroll or meet their expenses. I don't think that's going to be approved, and I don't think that's going to be a plan.
Ryan Kelly, Executive Director of the Alabama Rural Health Association, agrees.
Again, it's not going to be a blank check. It's not going to just go to the bottom line of the hospitals. Hopefully, indirectly, it will affect it, but directly, it certainly won't just be money to be used for just anything.
Those indirect benefits, Kelly says, could come in the form of improving healthcare outcomes. If federal money increases the availability of telemedicine or boosts the numbers of doctors and nurses, it could reduce the number of people without insurance straining emergency rooms. The federal fund works like this. About half of the $50 billion will be divided among the states. Alabama will get $500 million over 5 years. The other half of the money will be distributed based on how much of a state is rural and the applications that they submit. Senator Albritton, who is on an advisory committee appointed by Governor Kay Ivey, says he believes the money should be used to recruit and train healthcare providers who will lay down long-term roots in rural areas. Whatever the state does, he says, it has to be sustainable because the funds will dry up after 5 years.
How are we going to change ourselves so that we can become viable? That's the question. If we can't sustain this, the program is not going to be approved as I read it.
November 5th is the deadline to apply. Grants are expected to be awarded by the end of the year, but Senator Albritton says it's not clear when the money actually will arrive. Reporting live in the News Center, Brendan Kirby, Fox 10 News.